Hi, everyone. Thank you so much for joining us today. My name is Andrea Rochat. I support communications and outreach, as well as training and technical assistance for the Rural Telementoring Training Center, the RTTC, and am manager for the UT Health San Antonio ECHO program.
Hi, everyone. I'm Trisha Melhado. I'm the Senior Research Scientist and Evaluation Team Lead for the RTTC.
Hello, my name is Suyen Schneegans, and I am a research scientist and the training and technical assistant staff lead for the RTTC team.
Suyen, Trisha, and I are here today to talk to you more about the work we've been doing to improve rural health through telementoring. The story of this program doesn't begin with its funding, although that is important. I actually want to take you back several years before that, when this team and its partners were looking out at the health landscape in Texas and seeing what so many of you working in this field recognize: persistent gaps in care, limited access to high quality and specialist care, high rates of uninsurance, and workforce shortages. We were looking at Texas specifically, but I share national maps here because we aren't the only state facing these challenges. And we certainly aren't the only ones facing the consequences. Now, these are updated maps from the Robert Wood Johnson Foundation's county health rankings, but the story has been pretty much the same for the past decade. You see these deep pockets of green with poorer health outcome rankings based on life expectancy and quality of life. And that was a challenge we were seeing back then. And it's worth noting that according to these 2020 rankings, counties ranking the least healthy are parts of the Delta, Appalachia, and tribal lands, and do represent all community types, but are largely rural and facing those higher challenges that we know of: poverty, uninsurance, and unemployment. So in particular, we were looking at infectious diseases, particularly hepatitis C and HIV, but also the wide range of other factors that influence care for those patients, including insurance access, transportation, stigma, awareness, education, and so on. And we started exploring strategies that could leverage resources, expertise, knowledge, and partnerships to build up local community capacity for addressing a health priority. So whether that was webinars, online slide decks, community presentations, mobile apps, ECHO telementoring, one-on-one consultation, or more, we started learning how to meet community needs in a targeted, impactful way. And we learned too about the value of engagement in designing these programs around how critical it was for thinking about sustainability and offering ongoing support instead of building something up and then walking away from it. And we really began understanding the role of telementorship as distinct from telehealth and telemedicine, and as a mechanism for building community capacity for high quality care delivery and improved health. And that became a place to start. And we kind of kept seeing the same folks showing up for this work. And so partnerships started to emerge and those groups connected. And we started to see the growth of these collaborative networks for telementoring partners and the potential for what they could do. And so here we are, the Rural Telementoring Training Center. We provide resources, information, support, and education RISE for rural telementoring. And my colleagues will talk a little bit more about all of this, but briefly, this includes training and technical assistance, including online content you can access at your own pace, learning kits with updated resources, live trainings, tailored support for your program goals and audience, and ongoing support for design, launch, and growth of your program. And evaluation gets its own bullet point here because it's that important. And we do provide you with toolkits and support for assessing the quality and impact of your program. We focus on 6 types of telementoring, including Project ECHO, individual consultations, webinars, online curricula, podcasts, and community health clubs, which are a series of structured group sessions that drive community-led action around a topic of interest. If you're interested in that model, I strongly recommend you check out the sessions on day 3 of our launch week. And so that's a quick overview of how we got here, and I'm going to stop and pass it to Trisha.
Thank you, Andrea. As Andrea mentioned, the RTTC is not only providing telementoring resources, but also ways to evaluate those resources. In order to come up with the quality measures and best practices, we have taken a stepwise approach. First, we did a scoping review to identify what has been published for the 5 telementoring modalities in regards to evaluation. Then we did key informant interviews with experts who have implemented the different telementoring modalities to supplement the scoping review findings. Finally, we will convene a consensus committee to present the findings from the scoping review and key informant interviews to help come up with quality evaluation measures. I will be going over all 3 steps in more detail. This slide quantifies the types of evaluation that were found in the scoping review. At the bottom of the slide, you will see the number of articles that met the inclusion criteria for each telementoring modality. There were many articles related to online curricula and Project Echo, and there were a lot fewer articles related to podcasts and one-on-one consultations. The blue section shows themes and numbers of articles that looked at process evaluation. Yellow shows the themes and counts of articles that did outcome evaluation, while brown shows the themes and counts of articles that did impact evaluation. Overall, most articles carried out outcome evaluation, followed by process and impact evaluation. We did a total of 23 key informant interviews and are currently in the analysis phase. Some of the preliminary themes we identified are listed there on the right. Once we finish the key informant interview analysis, we will convene a consensus committee to help identify evaluation quality measures. We will include telementoring experts and rural health providers. We will use a combination of online surveys and an in-person approach via Zoom. Our inclusion criteria includes being a telementoring expert or having clinical or evaluation experience. We will also include people who work with rural and remote populations. The final product will identify quality measures for a telementoring evaluation toolkit. As we go through this process, we, meaning the RTTC team, are evaluating ourselves by participating in periodic guided reflections. These reflections help us identify what is working, any challenges, and what might need to be adjusted as we implement the RTTC. As we move further into RTTC implementation, we will expand the team members who will participate in these reflections. Speaking of implementation, I will now turn it over to Suyen to describe how one can become an RTTC learning partner.
Thank you, Trisha. So I will discuss the steps to become a learning partner with the RTTC. Becoming a learning partner with the RTTC takes 3 simple steps. Step 1, submit a TTA request form online. Step 2, complete our needs and readiness assessment to give us a landscape view of your needs, your resources, and your population of focus. And step 3, you're ready to begin your discovery phase with the RTTC TTA team. So step 1, as I mentioned, is submitting your TTA request. You can do this by visiting our website at ruraltelementoring.org and submitting and completing your training and technical assistance requests, which will allow us to begin your tailored TTA experience. So step 2, completing the needs and readiness assessment. This assessment is designed to help you begin to think about your program and to take a look at your current capacity. It will help you identify the healthcare gap that you're wanting to address, determine your population of focus, identify existing resource capacity and partners with the end goal of designing a successful telementoring program. And of course, here at the RTTC, our team's main goal is to meet you where you are at. So finally, step 3. This figure represents our tailored training and technical assistance process. As I mentioned, once you've submitted your request form and completed your needs and readiness assessment, you're ready to begin. So we will begin by meeting with our learning partners to work together on a tailored work plan for their telementoring modality program. We know this is an iterative process, so we will meet as many times as needed in order to review and edit the work plan until it's ready to put into play. Once the learning partner feels comfortable and is ready to launch their program, we will begin the implementation process. One thing to note, our assistance does not stop once your program has launched. We are always here to provide the support and guidance that is needed in order to have a successful telementoring program. And of course, in order to have a successful program, we need to evaluate its effectiveness to see what worked, what didn't work, or what can be fixed in order to improve it. And lastly, follow-ups. As I mentioned, we are always here to help. We will follow up with our learning partners at 1 month and 3 months post-launch just to do a check-in to see how things are going and let you know that we are always here to help.
Thank you, Trisha. Thank you, Suyen. So what's next? We're back where we started, doing that same work to build collaborative networks of telementoring partners. And we're doing this through outreach and engagement. So please do check out our website, contact us, and join us on social. We're also launching a YouTube page to share stories. Our goal here is to support rural telementoring programs at any stage of implementation, just thinking about one or looking to evaluate or scale up. And our goal is also to share those stories of rural health, of telementoring, and where the two intersect. Basically, we want to keep building this network, and we hope you'll join us. So thank you for your time and have a great day.